Hello, it's Rita Phillips, the office manager for Dr. Tinsley and Associates once again. This time I'd like to tell you a little bit about myself. I often tell our patients when they come in that I'm not just an office member or staff member, but I'm also a patient. All of our slides and pictures and things, we use real live patients. So let me tell you a little bit about one of the things that I've done. I had gastric bypass back in 2001. I lost an enormous amount of weight. I had a lot of fat and excess skin that I had to deal with. Dr. Tinsley did my tummy tuck. After that, I plateaued. My weight just plateaued. It looked like I wasn't going to lose any more weight. And therefore, I joined the Flawless Weight Loss Program that's offered in all of our offices. That includes Chicago, Naperville, Milwaukee, soon coming the Cayman Islands. So after joining the plan, I'm now happy. I'm losing weight more so than I expected, actually. And if you want to find out more, you'll be able to, ask questions with one of our offices. But I just want to show you one more thing. I want to show you what my before picture looks like. Shh. First, let me say thank you for coming through today. I understand that you're going to have a question for Dr. Tinsley. But first, tell us what your name is.
Kristen Schumann.
Okay, Kristen. What's your question for Dr. Tinsley?
I have a question about weight loss. Obviously, I don't need weight loss problem.
Right.
But it's for my mom and my brother. And I was wondering about either lap band surgery or gastric bypass.
Okay, now Dr. Tinsley doesn't do either one of those. So I'm just going to give you a little bit, information beforehand. He doesn't actually do those surgeries, but there are a lot of things that we offer for people after they've had those surgeries.
Okay.
So maybe we can get Dr. Tinsley to talk a little bit about that and what the differences are.
Okay.
Dr. Tinsley?
Thanks, Kristen. That was actually a good question. As you know, we have a flawless program, and under the flawless umbrella, we have flawless skincare, products, procedures, and services. The flawless weight loss program, which we're about to discuss in response to your question, and last but not least, flawless mole removal. Our flawless weight loss program is different in that our program does not emphasize diet and exercise. Diet and exercise are important. However, this program emphasizes metabolism. If you're a woman, particularly over the age of 30, and particularly if you've had any children, your metabolism starts to slow down. And if your metabolism is sluggish, it doesn't matter how much you don't eat and how much you do exercise, it's just difficult to lose weight. This program boosts the metabolism. Earlier we saw and heard from Ms. Phillips, our manager, who has participated in the program now for quite some time and has done extremely well. The program has several ingredients. The main ingredient primarily is vitamin B12, which we'll see in the next slide. With this program, we expect you to lose 2 pounds per week. If you exercise, you'll lose more than 2 pounds a week. If you diet, you'll lose more than 2 pounds a week. And obviously, if you combine the program with diet and exercise, we expect you to lose significantly more than 2 pounds per week. The main ingredient for boosting the metabolism is vitamin B12. B12 is an essential vitamin, meaning that you cannot survive without it. However, B12 is very interesting. B12 is the only vitamin that is not available in foodstuff. What does that mean? There's absolutely nothing that you can eat to get B12. B12 is manufactured in the intestines. B12 works by boosting the red blood cell count. The job or duty of the red blood cell is to carry oxygen. When we increase the red blood cell count, we increase something called the red cell mass. When we increase the red cell mass, we're now carrying more oxygen. Each beat of the heart then delivers more red blood cells, delivers more oxygen, or increases your so-called oxygen delivery. Oxygen delivery to the organs and structures, particularly lean muscle, is by definition the definition of metabolism. It's your consumption of oxygen. So B12 acts to increase the metabolism by increasing the red blood cell count. Obviously, as a menstruating woman, your blood cell count falls every month. B12 will counteract that and give you additional energy and additional burst to your metabolism that will make a difference in your life and assist you in losing weight. Secondly, chromium. Now, we've discussed the vitamin, which is B12, safe. B12 is water soluble. And what does that mean? That means there's no such thing as a possible B12 overdose. If you take too much B12, all you're going to do is urinate it off. Vitamins A, D, E, and K are the only vitamins that can possibly relate or develop a overdose. B12 is not one of them. The mineral chromium is very, very important. We talk about the calories that we put in our mouth, but in this particular program, the calories you put in your mouth are not nearly as important as the calories you have stored on your body. Chromium assists the body in mobilizing stored calories in the form of fat within individual fat cells out of the fat cell, and you feed yourself from the inside. The fat cell gets smaller, the fat compartment gets smaller, you get smaller, and it feeds you from the inside, thereby curbing your appetite. Water is very important to metabolism. We recommend you get 8 glasses of water a day. That's 8 8-ounce glasses for a total of 64 ounces of water a day. There are different equations and calculations out there for water, but 8 glasses a day, 64 ounces, is good for the average adult. Some people, however, after they've consumed the normal quantity of water, they may retain water in their tissues. Circulating water and retained water are not the same thing. People with a history of retained water, we recommend hydrochlorothiazide. If you only retain water in association with your cycle, we recommend that you take hydrochlorothiazide for 10 days. 5 days before your expected menses or on the day of ovulation. Many women cannot tell when they ovulate, so we generally recommend, if you're one of those women, you start 5 days before your anticipated menses. Last but not least, the diet pill. This diet pill, combined with these other ingredients, B12 and chromium, we expect you to lose 2 pounds per week regardless of what else you do. Again, if you diet and exercise in addition to the program, we expect you to lose more than 2 pounds a week. If you say, Dr. Tinsley, I want to lose 20 pounds, I'll say you'll reach your goal in 10 weeks with this program, regardless of what you do. This next slide combines the Artist Body Magic garments with our flawless weight loss program, and we call it the two-step system or the two-step program. The Artist garment, particularly if your BMI is less than 31, will allow your body to be contoured while you're losing weight, thereby maximizing your physical appearance in addition to your weight loss. So in review, our weight loss program focuses on the metabolism. We encourage you to exercise. We encourage you to eat right, whether you define it as a diet or not. And you also have the option of participating in the two-step weight loss system. Women are doing very well, as are the men. The majority of the clients, however, are women, particularly those women who are over the age of 30 and who have had children. They have seen significant benefits from participating in the Flawless Weight Loss Program. I hope that answers your question, and thank you.